2025 was a tumultuous year. We saw large-scale rollbacks to DEI programs that have left organizations navigating changing priorities, policies, and budgets. And in the new year, more changes are coming. That's going to make health insurance coverage more expensive for millions. But we are still here, and we're committed as ever to this fight. You're showing up for your communities and finding creative ways to continue driving equity efforts forward. So today, let's reflect. Let's provide some motivation and inspiration to kick off the new year. Let's jump in. Hello, and welcome to the Intersection Podcast. The Intersection is a Robert Wood Johnson Foundation project built to create space for advocates to share how they're working to build anti-racist healthcare systems. I'm your host, Anton Gunn, and I'm here with Jerry Jones from the Robert Wood Johnson Foundation, Becky Payne from the Rippel Foundation, and Angela Hanks from the Century Foundation. Today, we're going to focus on health equity wins from 2025 and discuss how organizations can stay hopeful, motivated, and innovative as we continue this work in 2026. Becky, I'm going to start with you. As I mentioned, 2025 was a tough year. What's one thing that happened in 2025 that gives you hope, and were there some bright spots that you can point to?
Yeah, it's a tough question, right? But I think one of the things that has given me hope is how many of us are finding each other. And I think with everything that's happened, we've been given permission to just shed our conservativeness or our timidness, and watching so many groups who may have historically been in competition, may still be in competition in some ways, overcome that and recognize this is not about us
Mm,
as individuals. It is about the collective we. And I see people wrestling with what a new social contract can and should be.
yeah, very good. Jerry, how about you? What in this rough year, what's been hopeful for you, and where are the bright spots?
One, I feel like there's so many different places that are giving me hope, but one of the things that stands out to me is just watching a lot of legacy grassroots organizing organizations who for decades did not play in the sandbox well with each,
Mm,
who over the last, really even before the last year, have begun to come together and thinking about how they organize and strategize in ways together that have been, I think, have shown us as a philanthropy ways in which we might want to reimagine how we partner across the philanthropic landscape. But I'm seeing hope in how communities are organizing and building power that are showing me ways that, hey, there are things that we could be doing differently and need to be doing differently in order to be the best partner we can be in the moment that we're in.
very good. Angela, a little bit of your world. I want to hear some insights from you on this.
Yeah, the thing that I'm most hopeful about going into this next year is that I really do think there's an opening to do something big and meaningful and transformational for people on healthcare. I'm seeing both a incredible amount of energy from our team, but really across the policy ecosystem. Frankly, folks that I did not think would be spending a ton of time on healthcare in the next year, really investing their time and resources too, to Jerry's point. And so I think we're starting to see the beginning of something, and that's really exciting. Again, there's a lot of momentum to be sustained. There's a lot of work to figure out what do we want those systems to look like, but the energy going in is quite high. And I think after a really tough year, that's somewhat surprising, but really nice to see.
Yeah, very good. And Becky, I'm going to go back to you. I would ask you about what are you looking forward to in 2026, but I know you like to break rules and go a little bit beyond 2026. So can you share a little bit of context of what do you see going forward, or what are you working on going forward?
Yeah, thank you. Thanks for giving me permission. I want to encourage everybody to remember you can break more rules than you think you are, and no harm comes. And you might actually get a heck of a lot of good out of it. Well, thank you for encouraging me to break rules. And I want to encourage others to break rules too, and recognize that there's very little harm often that comes to you, and you might actually bring some people along with you. So we are focused on the next decade.
Mm,
Frankly, we focus on generational change, but that's a little hard to wrap arms around. So we're going to be calling people in to help us collectively, really intentionally increase the number of Americans who report that they're thriving by 20 points in the next decade. And I know people wonder, well, how are they measuring that? So let me just share for context. We use Cantrell's ladder. Gallup has been measuring this for several decades. We have a number of communities that are now also using. It's a 2-question instrument that's very easy and it is self-defined. To use that measure as a way to understanding who feels like they're thriving and who is struggling and suffering, and then be really clear about what are the things that we are all committing to do that might move that measure. It is a bold goal in that time horizon. We are currently at 49% of Americans. That is unacceptable. Even 69, if we're successful, is unacceptable. However, we've never gone above 59.8. And I think we need to really stop using that just as a North Star and a passive surveillance measure. So we're hoping that that intentionality of calling people in to join us and be really clear about there are some nice to do things that don't actually have the intended impact. And there's some really transformative big moves that need to be made that if we get enough of those rolling up together, we just might be able to move that needle.
Wow, that's fantastic. Man, fantastic to hear that. It sounds like big long-term picture and some metrics in there that know and show that you're making a difference. Jerry, I'm going to ask you about RWJF in terms of what are you most looking forward to in 2026? What do you see the biggest opportunities and what are you looking forward to see happen?
I think both Angela and Becky, from the notion of going big and breaking rules, what I'm looking forward to is our team really working deep in partnerships to really begin to be a part of that co-creation of what the vision for America is. And I believe that the work that we're undertaking, it's so much bigger than our public health system. It's so much bigger than our healthcare system. I think we have the opportunity to truly weave a multiracial, multi-generational, multi-gender democracy. Ultimately, all of this work that we're undertaking is about inclusion, like for no one being left behind. So I feel like a lot of the work around policy change is tinkering around the edges. And oftentimes the reality was, I feel like we were negotiating who was going to be included and who was going to be excluded. And what I'm looking forward to is that no one gets left behind in this affirmative vision for America. And I'm excited about the pursuit of that and only that. Nothing less than that is acceptable.
Yeah, so good to hear. Angela, I wanted to ask us particularly at your foundation, like what are you all zeroing in as an opportunity in 2026 specifically for you and the work that you're doing?
Yeah, so I'll name a couple of things because I can't say that we're zeroing in. We're sort of like zeroing in on a couple of different areas, but I'll name a few. One, we are engaging in this kind of big picture conversation about what are the healthcare systems that we want to exist in this country. And I'm really excited about that work. We're diving deep in a couple of areas where we have specific expertise, like maternal health. As a think tank, we're also thinking about what is the research and analysis that we can do to help drive these policy conversations. One kind of important role that I think we've been able to play over time is really making the case in a way with data, with research, with analysis that really makes it hard to ignore the policy solutions that we're advancing. There are some new areas for us in that as well. We are spending a lot of time thinking about debt. That includes medical debt. So we're doing some initial analysis there that will both look at medical debt and isolation really at a granular level. And we've actually done this with some data we have looking at other types of debt, including utility debt. And we're planning to do the same thing with medical as well, but also the interactions between medical debt and other big financial decisions in people's lives. What does it mean for student debt? What does it mean for housing? What does it mean for auto debt when you have this big medical bill that's weighing on you? And so I'm really excited for new analysis that we'll do there. And that is all like long and difficult work. And again, I think the conversations that we're having or going to have in this next year are just of a different nature
Hmm.
than the ones that we started the year having. And that's really exciting. And it gives us a lot of opportunities to think about like, what is the work ahead? How can we be creative in this moment? And how can we use our skills as an organization, as researchers, as analysts, and as policy experts to really think big in this moment and work alongside people who are doing the important work on the ground, organize,
Hmm.
right? Like this doesn't happen in a vacuum, and you need all of those pieces working together in order to really make this move forward.
Wow, that's great. So helpful. Now, I want to shift a little bit, and I like to shift here because you all are powerful leaders in philanthropy and policy, helping to shape a more equitable, anti-racist future. But I know you just didn't show up here to do this work today. When you were in third grade and your teacher asked you, "What do you want to be when you grow up?" I don't think anybody said, "I want to work in philanthropy and do policy and advocacy work," right? I want to hear your story. Why do you choose to do this work? What brings you to this work and what keeps you in the work? And Becky, I'm going to start with you.
Yeah, I think my response in 3rd grade was I wanted to be an archaeologist. But I was raised by public servants, and while I did a stint in crisis counseling in a shelter and found it incredibly rewarding, I was extraordinarily frustrated with,
Mhm.
the proverbial analogy we're all familiar with about just helping people out of the river versus the bigger system.
Yeah.
And also the lack of dignity and humanity that was afforded those individuals for the conditions that they found themselves in that were societal issues and conditions. So it was both a frustration with the systems that existed, but also just how heartbreaking it was to see how people were treated as individuals. So for me, I didn't know what public health was. I don't have the pedigree a lot of my peers and colleagues do. So I didn't have that to look up to, but I just kept, for whatever reason, I kept just being unsatisfied and wanting to go farther and deeper and have meaning. I needed to have meaning in my daily life. If I'm going to leave my family every day, it better be for something. And we don't all get that privilege, but thankfully I did and I do. What keeps me going is being able to see how much is possible. And for whatever reason, I've been granted a gift of both place and privilege and some ability to help people see that from time to time. And watching where that goes, that is way beyond anything I can do alone, is incredibly life giving. So I do this work because what choice do we have? Honestly, we've got to leave it better than we found it. It's heartbreaking. It won't be as good as I would hope that it will be, but I get to sleep at night knowing that I get to work on things that are really important. And I get such inspiration from being able to be in community with people who are on the ground making their communities better day in and day out.
Yeah, that's fantastic, phenomenal, and so appreciate you sharing. And glad you're not an archaeologist, right? And glad you're doing this work. So, Jerry, how about you? How did you get here doing what you're doing, and what keeps you going? What gives you hope?
Similarly, I loved all the Indiana Jones movies, and I was convinced that I too wanted to be an archaeologist until I got to college and realized how much study it would take to actually do that. Like, oh, you don't get to do all the adventure stuff. Also, similarly, I was working with individuals with disabilities, and it just every time I was working with someone, it just seemed like obstacles were being put in their way on purpose. And it started as an irritant, but then it just became something that really ticked me off. And like, what can we do about this? And so I just started volunteer community organizing, and I just kind of stayed with it and stayed with it. And ultimately, just started organizing full time. And it's a long and winding road. We would need a whole different podcast talk about how I got here. But I know I don't have a background in public health. I certainly, that was not on my radar in my studies, but I just stumbled into it because the fights that I got involved with as an organizer kept leading me there. And every fight that we would win or lose, it just made me want to fight harder and smarter.
Hmm.
So, what gives me hope is all of the partners who are in the fight. And I'm excited that I can relate to the director that has maybe two or three staff. I can relate to folks in community who are organizing their block. And I also understand what our community foundations are going through and trying to figure out how to navigate in this space. So I think what gives me hope is that all of my really odd experiences somehow have been able to culminate in me being able to provide support to the field in this really random way. All of it has actually led to something.
Oh, fantastic.
Yeah.
Thank you. Angela, tell us your story.
So I don't think I would have said I'm going to work in public policy in 3rd grade, in part because I didn't know what it was. But I don't think I would have said something very far off, actually.
Okay. Okay.
And here's why. I grew up in a household that was really active. I had family members who were union members, which meant I have been on many picket lines in my life and childhood. The first time I came to Washington, D.C., it was for protests for reproductive justice. And I was, I think, 5 when we made the drive from Michigan to D.C. to protest for the rights of women and birthing people. And so that type of, I think, both knowledge of the power of collective action and the ability of it to make change is something that I think is just been a constant in my life. And then two, the thing that I also kind of glean from those experiences is you start to realize that the economy such that it exists is often deeply unfair.
Mm.
It's deeply unfair to working people. It's very divided by race and gender. There are deep-seated inequities that exist that frankly are so embedded into our economic systems that once you see them, they're kind of hard to ignore, right? And so when I think about what I was interested in life, it's like, okay, well, I know there are all of these things in the world that are happening that I want to be a part of. What is the best way that I can do that? And this felt like the right way. I don't think I've had sort of like a clear line to what I'm doing now at any given point, but I have really been driven by those questions about what do we want our economy to look like? How do we make sure that it is fair and equitable and just for regular people in this country? And you shouldn't have to spend all of your weekends on a picket line in order to get fair wages, right? Like there are some basic things that we should provide to people. You shouldn't have to protest in DC to have control over your body. And there are ways that we can address that with policy, and that is really one of the things that's helped drive my career. There are many other ways that the way that I've come along working on particular issues over time, but it really is trying to think about what would it take to make the lives of just regular people better, and that's a question I think I'll spend the rest of my career trying to solve.
Very good. I'm going to close this out. I have one additional question. Is what I call my one in one. One piece of advice that you would have for emerging leaders or future leaders who are doing this work, and what's one goal you have for next year? So again, one in one, give me one goal for next year and one piece of advice for the young Jerry, the young Becky, the young Angela who's just getting started in their career, who wants to focus on equity and justice and fairness and better outcomes for people. And Becky, I'm going to start with you.
Yeah, well, I shared our decade long, so I will follow the rule this year. So, my unrelenting goal for next year is to bring as many people into dialogue with us, with them, to co-design what it looks like to actually bring that 20-point increase in the next decade
Mm,
into being. So, we're going to
mm.
spend the next year relentlessly in conversation, co-designing that with anybody who wants to join us. My advice for emerging leaders is, um, don't forget the joy. You don't have to crash every wave. There's a community around you, and you need to remember to rest. And my starting point earlier for everybody is also remember to stay humble and curious. Humble and curious in your youth, but also as you age and reach the latter part of your career. And then I think lastly, in particular for this time, help us, the rest of us, move out of the way.
Yes.
We've gotta cede the space to the upcoming generation. We were not equipped to live in the world that is forthcoming, let alone fully design it, and we may need help, some of us more than others, ceding that space, but don't give up on helping us cede that space.
Fantastic. Fantastic. Jerry, what's your one and one?
My one goal is that we push ourselves as a collective to develop a playbook for how we move things forward in this year. And actually, Becky, I'm going to break a rule because I got two recommendations. One, when in doubt, reach out. You're not in this work alone. Find your community and don't like struggle with it by yourself. You've got others around you, and please reach out. And then the other, Becky, to follow up, to build on yours, I want those who are newer to this work not to settle and to be insistent and to push. Do not wait for permission. Push, push. And if we are in the way, get us out of the way. But keep moving.
That's right. Angela, how about you? What's your one goal and then one piece of advice?
My goal is to just keep healthcare at the top of every policy maker's mind and decision maker, and make sure that this moment that is really born out of genuine crisis turns into opportunity, turns into a better system for people across this country. And that's, I think, a shared goal across many, many hundreds of thousands of people in this country, if we're going to accomplish it. But that feels really important. And then my advice is just that it can be at all times a really lonely experience to work on racial justice, racial equity, and especially right now where we're seeing real rollbacks both out of fear, but also because it's an opportune moment to walk back commitments. It's really important to stay in and stay true. And I really echo what Becky and Jerry have said about finding community. It's the only thing that gets us through, finding like-minded folks, whether it's at your organization or somewhere else, the people you can call up and say, I can't believe this is happening. What are you doing about it is really important. So I hope folks are taking care and finding that community where they can.
Outstanding. Becky, Jerry, Angela, I want to thank you all for joining us today. At the intersection, we're all united in supporting the movement towards anti-racist healthcare systems, even when the times feel tough. And as always, we'd like to thank our loyal subscribers for listening. If you're new to the intersection, stop by again for more conversations about achieving an anti-racist healthcare system. Head over to meetattheintersection.org to sign up for our mailing list. You can stay up to date on upcoming events, uncover resources to help guide your organization's work, and don't forget to follow our LinkedIn page to join our community of advocates invested in creating anti-racist healthcare systems. The views expressed here do not necessarily reflect the views of the Robert Wood Johnson Foundation. The foundation does not support lobbying efforts, including any activities or communications referenced during this podcast.